June is National Cancer Survivor Month. Dr. Shannon Cox is a board-certified radiation oncologist with Austin CyberKnife, and he's here to tell us more. Good morning to you, Dr. Cox. What does National Survivors Day really represent?
Well, typically two things. One, not only cancer patients undergoing treatment, also cancer patients that have survived treatment and are living with the long-term side effects and uncertainty of worrying about their cancer. But it's also been traditionally used to kind of celebrate advances in cancer. And around 1990 was one of the first times there had been an overall decrease in the death rate of cancer. And I brought some statistics real quick. So since 1990, lung cancer has declined, death rate 45%, breast cancer 39%, prostate cancer 52%, and since 1970, colorectal cancer has gone down by 52%. And part of that is due to advances in technology. Part of it is due to screening and early prevention. And things that have improved on the technology side are in the surgery realm. They're like the robotic surgery, which is less invasive, targeted chemotherapy, therapies like CyberKnife, which are able to do the job with much less toxicity, both for primary and recurrent cancers. The other thing people can do, of course, is better preventative, and that includes decreasing tobacco, alcohol, diet, keeping your weight down, more physical activity, fruits and vegetables. The other thing is screening, better screening, now mammograms, colonoscopies, even getting things like the HPV vaccine. We know that certain cancers, cervical cancer, head and neck cancers are caused by virus related. So considering getting the HPV vaccine is one that'll help too. So this day has been a combination of celebrating increased cure rates and the patients that have gone through with it, through cancer, and what it means to them. So,
yeah, I hear it from you, a real celebration. I was at a cancer walk just a couple weeks ago, and really from day one of diagnosis, you start saying, I'm a survivor, because you need to have that mentality moving forward.
And there's no question that attitude helps.
Yeah.
I've seen it over and over in my practice where a better attitude helps you get through whatever, the chemo, radiation, whatever. Yeah.
Important to hear. Okay, tell us a little bit about how Austin CyberKnife has kind of factored into this, how it's made things better.
Well, again, it's getting into that less toxicity, and it's more focused, the less collateral damage. And the CyberKnife in particular is better not only for some primary cancers, but also for recurrent cancers. It just, let's say an area that's been radiated and you've got kind of a maximum dose within that. If you need to come back within that, we're a very targeted treatment. So, but also I like to say surgical advances, robotic therapy, targeted chemotherapy, all those have decreased side effects, increased cure rates.
Well, it's a really positive bit of news to hear this morning, and I know you've been in this field for 30 years, so we can trust the information coming from you, and we appreciate you being here this morning. Thank you so much, Dr. Cox.
Thank you.
Austin CyberKnife is located on I-35 near the Del Seton Medical Center at the University of Texas. Call them at 512-324-8060 or go to austincyberknife.com for more information.